Hello, good evening, and welcome to the second episode of Healthy Baat, an initiative of the Essex Indians Charity, a registered charity working for the holistic well being amongst the Indian diaspora and the larger British Asian communities. Founded by like minded Indian expats more than a decade ago, today Essex Indian benefits from having more than 200 members. Our core mission is to create a sense of belongingness among second generation British Indians to both the British and Indian culture they belong to. EI actively supports young people in learning and being rooted to their culture and language through the online language classes, gives them opportunities to learn more about the Indian culture through art and music. Simultaneously, our community outreach programs focus on both physical and mental health through regular health checkups, badminton clubs, walking club, etc. It is an extension of EI's focus on community health and well-being that we have initiated Healthy Bath, a series of conversations with physicians and subject matter experts answering health-related queries sent by people across the community. I'm your host, Meghna Das, a public health and development professional for nearly 2 decades, and tonight I'm in conversation with child health and development child health and development with Dr. Himadri Chakrabarty, consultant pediatrician working in peds for the last 25 years, and subject specialist gastro, allergy, nutrition, and everything else related to general peds. Please welcome Dr. Chakrabarty.
Hello, good
Hello.
evening, and thank you for having me on this platform, which I think is a fantastic initiative by SS Indians, and I'm really honored to be asked to be joining for this. Thank you.
It's always our pleasure. Just a brief intro as to how we proceed. So, we have over the last 2 or 3 weeks received a lot of questions from the members of the public, from not just Essex Indian members, but throughout um, about child's health and nutrition. I've compiled them, and for the interest of time, I have kept similar questions together. Um, and I will go and ask one by one.
Sure.
And yeah, right. The first one first. My three-year-old goes to the daycare and is constantly sick with cough and cold, occasionally leading to fever. Is there something I can give as an immunity booster? This is the question that's come up.
Yeah, I think as a pediatrician, this is probably one of the commonest reason why we get referrals from GPs and some of the commonest queries we get from parents as well when we see them in the children's emergency department or in the clinic. It is a very, very common condition. It is in the early years of their life, they all have different viruses that they are not immune to, and they will pick up these viruses. We in pediatric parlance call them by nursery syndrome. So sometimes when they go to nurseries, obviously it starts off quite often. Also, if you have an elder sibling who goes to nursery or who interacts with other children, you will get that, and you will get these kind of recurrent viral infections, which is actually an immune building process for these children. So there are around 40-50 viruses that goes around in the community. They go
40,
and pick them
50.
up. Yeah, nearly 40-50, and every year it's increasing in numbers. As you know, new viruses are mutating and coming in places as well. That's why we all get new flus every year as well. So what happens is these children then pick up these viruses, they get immune to those particular strains, and then they move on to the next virus. And it seems like it's a constant thing that goes on for these children. And that's why we kind of jokingly term this as nursery syndrome. So in terms of immune boosting question that one of your esteemed viewer have asked, generally normal healthy lifestyle, normal sort of uh, food habits, obviously not too much junk, but in terms of immune boosting, vitamin C is a very good immune booster. In natural form is the best form. So natural fruit juices, natural orange juice, for example, tomato juice, so these are all rich in vitamin C. Vitamin C is a very good rich immune boosting thing. The other thing which Asian communities, obviously because of our skin color, we are deficient in often, is vitamin D, because vitamin D is produced from sunlight, and as you know, in UK, sunlight is premium. We are obviously very, very lucky in terms of not getting much sunlight in this country. So we don't produce that much of vitamin D uh, especially Asian and Afro Caribbean communities who have darker skins. So having some vitamin D supplements, especially during the winter months, is definitely a good idea. Vitamin D is a big contributor to our immune system stability. So a combination of both of them would be helpful. Ideally, in natural form. So vitamin D is naturally found in lots of, oily fishes is definitely one example. Your boiled eggs that has got rich vitamin D as well. If you can expose to sunlight, then that's good in the summer months. That will boost up your vitamin D store. And in terms of vitamin C, you have all the fruit juices, orange juice or tomato juice, all the citrus fruits essentially are rich in vitamin C.
So would the so I understand fruits, and of course there is no way you can substitute fruit for a medicine. But
Yeah,
I see, when I go to a supermarket or the regular pharmacy, I would see a lot of these supplements being sold, like vitamin C booster, or
yeah.
takes care of overall health. So, is that something that you could possibly give a child, or does it
You
help?
can. You certainly can. You certainly can get those vitamin C zinc combinations that is available. There are these chewy gummies that is available.
Yeah,
But we have to keep in mind many of these ones will obviously also be produced with artificial sugars in it as well.
yeah,
So you're then looking at, all these gummies to make them palatable for the children, they obviously have a little bit more sugar. So not always the best choice. If you can do fruit juices naturally at home, even if you give sort of maybe a spoonful of honey into that to make it a bit more palatable, or even a little bit of sugar to make it a bit more palatable, is still better than having those over the counter ones. Saves you money on the long run as well. But more importantly, if your child would not have the natural fruit, what I normally suggest to parents is, those handmade juicers, you can just kind of make the orange juice in that, and make some honey and give it to your child if you would take it. Most children would not like it. Most children would like those gummies and they would want to have it. If you can't get the natural option, then obviously you have got the other option to give them some supplements, and it helps in terms of supporting your immune system a bit. But natural is always the best option.
yeah.
And very honest, I always tell the parents as well that if you're having multiple infections, multiple virus infections, it is good thing for your child, because that child is getting immune to those viruses, and by the time they reach 5 to 6 years of age, by the time they reach the school age, they have gone through majority of the common viruses and have grown some degree of immunity to them. So their frequency of these infections start coming down significantly by the time they reach their school age. And that's one of the primary reasons why school age more universally is usually 5 years of age.
Oh, I will never put that together. Yeah. So yeah, that's always a primary concern with me, because I have a 4-year-old who's always sick, and she goes to daycare. So now I know that that's a legitimate thing. She's not special. So they have something called a daycare syndrome. Uh, the second question that I have is from
Sorry,
another
Meghna,
mother.
before you go to the second question, because you mentioned something
Yeah.
important there.
Oh,
Whilst it is definitely a immune building mechanism with the viruses, if someone's getting a lot of unusual kind of infections, like they're constantly having sort of, they're not gaining weight, they're having constant skin infections, so oozing skin infections, recurrent skin infections, having recurrent fungal infections, so those kind of things are red flags which we need to be aware of. So if you're not gaining much weight, if you're having those kind of recurrent infections, severe recurrent chest infections like severe pneumonias or something like that, then that needs to be looked up. Then the immune system needs to be checked, and we need to do blood tests for that to see if there's an immune deficiency or not. But you will usually,
that's a yeah.
yeah. So those are the red flags you need to be aware of, not just the common cold and cough. If the child is growing healthily and they're absolutely fine, they're very active and just having those intermittent ones, I wouldn't worry about them at all. But if someone's having those ones, they're not gaining weight in spite of um, eating fine, then we need to be worried about, and that needs to be checked out.
Okay, that got me worried. But the next question that I have is, so my child is born and raised here. Are there any travel vaccinations they should be given when traveling to India for a holiday in winter or summer?
Okay. Another important one that comes up. First of all, I would like to inform everyone in this forum that travel vaccinations are widely available. If you approach your GP surgeries, they have travel vaccination nurse. Most GP surgeries will have travel vaccination nurse, and they have a list of different countries and which vaccines are required for those countries to visit for the children. And that's usually how this happens in this country. So that's one of the things I would recommend to anyone asking about travel vaccinations. But generally for India, the ones that you definitely want to, I mean, most of the ones that we have in vaccinations in this country covers from the hepatitis B, because hepatitis B has been introduced recently as well.
Yeah.
You have got the polio cover as well. You have got the tetanus, diphtheria. All the ones that is available in India are already done, as in 6-in-1 vaccine given to these children at 8 weeks, 12 weeks, and 16 weeks of age. You have also got the rotavirus vaccine been given. There is meningitis vaccines given for the children, and pneumococcal vaccine given for the children as well in the post primary immunization schedule. By 1 year of age, you get the MMR vaccine, and then you obviously get a booster MMR by 4 year of age with booster of the tetanus, typhoid, those ones. So those most of the ones will be in part of the national immunization schedule of India as well. So that kind of covers
Yeah.
them for that. The ones that you want to have some cover are typhoid, which is not a part of
Yeah.
the cover in UK. If you're going to India, then you would definitely want to have typhoid cover, but you can't really do that before 2 years of age. So the inactivated typhoid vaccine can be given around up beyond 2 years of age, and the oral typhoid vaccine is available to be given from 5 years of age. And it is the oral vaccine is more, it's a live vaccine. It's basically a live bacteria that you're giving in small quantities to produce immunity, so instant immunity, and you need 3 tablets of that or 3 capsules of that before you travel. But the injectable one is one off, and then you can booster it every 2 years to 3 years if you need
Mhm.
to. That's from 2 year onwards. That's a typhoid one.
Yeah.
The other one I would recommend when was going to India is hepatitis A, which is not part of the scheduled vaccination in UK. Hepatitis A is again much more common in waterborne. It's a waterborne disease. So obviously, in India, in different parts of India, there might be problems with the water quality, and that might be needed. So hepatitis A vaccine is another one that can be given. Again, this is a two vaccine program. So you do one at 0 months, and then a one at between 6 to 12 months. That covers you for almost 20 years.
20 years. So
Yeah,
there's one vaccine that I recently came to know of and thus gave it to my child. It's not part of the NHS, was the chickenpox vaccination. So I understand that there are a lot of other vaccinations which are not possibly part of the general,
yeah,
um, like, but they are available. You could speak to your GP about it, and
absolutely.
then you could get them for private.
Yeah.
Um, I thought because it was available, that it was a good vaccine to give. The other vaccine that I see a lot of people going to India get is definitely the typhoid vaccine, as you mentioned, because
Yeah.
you're always scared of the waterborne diseases. Now, the third question that we have is related to well, gastrointestinal health. I think a 4-year-old girl is otherwise healthy, but when she's constipated and when she's trying to do the poo, she always throws up. Is this indicative of something?
Uh, Not really, because it depends on, first of all, how bad the constipation is and how frequent. I wouldn't have the details of that one. But sometimes what happens is if they're blocking up, and this is obviously very much into my territory, and this is where with gastro, I see a lot of complex constipation. My colleagues refer me for complex constipation children as well in their practice. So one of the things about constipation is when you're is just in simple terms to explain this in a bit more detail. If you're having a basin pipe getting blocked, then what's going to happen? You're going to get the basin overflowing. You need to use your Mr. Muscle, put the stuff inside the pipe, and then you need to run your hot water to clear things out. Exactly similar concept, just different plumbing. In the body, plumbing is different. So what you need is, if you are getting really blocked up and you are building up for some days and you're not going to toilet for say 4 or 5 days at a time, and I have had children who had come to me, they are not going for 25 days, 30 days at a time. So if you have that much of blockage, what happens is there's nowhere for the poo to go. So the body starts building up, and then they start stretching and stretching the gut to accommodate the extra amount of poo that's being built up in the body. So once it is building up and it's causing a backlog, you are then going to get a backflow pressure sometimes in your stomach when you're trying to do the pressure. That then causes a backflow pressure. And if someone's already having a degree of regurgitation from the stomach, which we call reflux, then they would obviously create that much of a pressure in the stomach to be able to then throw up. So one of the things to note would be, what would be interesting to know is how often she goes. And if she's not going for say 3 4 days at a time, then I would recommend that she should be started on some medicine, a stool softener medicine. We call them macrogols, and there are different names: Movicol, Cosmocol, Laxido. These are all different names that can be used for the child. And if that doesn't help and the poo is still very hard and causing a lot of discomfort, then you can add in what we call a stimulant laxative, which is something like senna or picosulfate can be added on. So yeah, it's a common phenomenon. We see that quite often, that people lose appetite, people lose weight, people have more sickness from having chronic constipation.
All right. Okay. Yeah, it's a very, I think it's a very common thing, especially with
60% of
babies.
referrals to pediatrics is because of constipation or abdominal pain related to constipation.
That is a very scary statistics. And I remember as a young when I had a baby, that was my primary fear, that either my child will be constipated or they will have runny poo, and I wouldn't know how to deal with either. I have the second question. Another question that I have is it good to introduce a dummy for babies? Does it cut down SIDS risk?
Very, I mean, it is a contentious topic generally, amongst pediatricians as well and among experts in there. Is Yes, there are certain studies which have shown some benefit from using dummies, because the whole point, and this is where it becomes interesting, the reason why we use dummy or pacifiers, as we call it, um, is to help a better sleep for the baby. When they're suckling, then obviously that gives them a bit of a relaxation that makes them go to sleep better, is the general concept, which is why you are using dummy. Or if they're in pain, if they're in discomfort, then sucking the dummy gives them that sucking reflex, which induces that relaxation in the baby's mind, and they settle down a little bit as well. So this is the reason why dummy is used. And if you have a relaxed sleep, if you have a better position sleep, then obviously the theoretical risk of SEEDS, or sudden infant death syndrome as its full form, is reduced or supposedly reduced. Certain studies have shown that, certain studies have refuted that. So there hasn't been a general consensus that it definitely helps with preventing SEEDS, but there is no harm from that point of view in terms of using it as a relaxation one. What we do not recommend is to use dummies all the time, like 24 hours. You're
Mm.
using dummies mainly as a pacification for a few hours a day, or some just to get them to relax to sleep, or if they're in pain, to sort of comfort them, then that's fine. That's okay. Because if you're using dummy too much, then that dentition, when the dentition starts developing, that starts causing problems as well. So that's the reason why it is not recommended as much and as frequent. I mean, you use it to mainly as a temporary measure from pacification point of view, to help them sleep and what have you. The other thing about dummies are, apart from the dentition, there are certain studies. Again, there are sort of contentious issues about that. American Academy of Pediatrics actually have had a recent consensus about this, that using dummies helps reduce ear infections, which
Yeah.
again is not again, there's a jury out on that one, because no one actually knows. It's the suckling bit which causes help in terms of the opening of the eustachian tube, helping in terms of sorry, not helping with the ear infections. It can cause ear infection. That's the thing, that it can block the eustachian tube, and that can then cause the infections to build up. So that's why they don't recommend it to use too long. They recommend it to sort of use off and on generally. Again, the jury is out on that.
You
Evidence is not very strong on that one.
you brought another dimension to the discussion, and that's SIDS, sudden infant death syndrome. What is your opinion about BAME communities and SIDS? Because again, SIDS is something that when we were growing up in India, we never heard much about it. Maybe that was because, well,
Awareness.
that was awareness, yeah, um, where there is. And yeah, what is your opinion about the community and SIDS and our awareness levels about it? And because I think a lot of the time there is a confusion between SIDS and asphyxiation, um, and that creates a lot of challenges there.
Yeah. Uh, I mean, one of the I think one of the reasons why it might be slightly more in BEM communities generally than the Caucasian population is our sleep habit. Is the way, the cultural habit of often taking the baby in your own bed and sort of sleeping, and that can increase the risk of asphyxiation for these babies, because tired mothers can sometimes, and what we see often, in fact, we get this in the emergency department at least 3 or 4 a year, where baby has been brought dead, having mom sort of being too tired and had the baby on her lap, then the baby sort of was put down on the bed by the side of her, and then obviously uh, got smothered because of the fact that mom sort of slept on the baby. That's the reason why we always make sure, I sort of say to new moms, that you must put the baby on the baby cot. If you're putting the baby on the bed, then make sure that heavy blankets are not around as well, big pillows, because on your bed, the main problem is you will have your big pillows, you will have your big blankets, which for a baby of within the first 3 4 months, when they're not turning around, in fact for the first 6 or 7 months, when they're not turning around actively, they will be very difficult to get rid of that blanket coming on their face. So that's the reason why when you put the baby in a cot, you obviously tuck them in properly as well. So there are those kind of cultural things that we, as a community, both from our Asian communities as well as Afro-Caribbean communities, we have the culture of having our babies in our cot, because the baby is crying too much and you would like to sort of have the baby by your side so that you can look after it better. But that sometimes can have its implications, as we just mentioned. Apart from that, there is no other specific reason for that, except for the fact certain communities, obviously, there is more prevalence of metabolic disorders. So certain communities will have consanguinity issues, and that can sort of then lead to more high risk of metabolic disorders. And if they're metabolic disorders, then sometimes these are undiagnosed metabolic conditions for which they can have um, a sudden sort of cardiac problems, sudden cardiac arrests, or respiratory problems, and that can lead to problems as well. Or someone who is known to have cardiac problems, or have regular problems with breathing as a baby, should be always checked out fairly early on to make sure that there is no other reason why this child would be going blue in their faces, or have a difficulty with breathing. Um, so that's the other thing. But that's another thing that sometimes can affect or tilt the balance more towards the BAME communities.
Okay, that's it's I think it's both a little scary, but at the same time extremely relieving to understand that this is what happens. The awareness is the only way of reducing something like SIDS,
Yeah,
and especially asphyxiation, which is not SIDS, but
yeah,
there is a lot of confusion as to what it is. So yeah, thank you for that.
yeah. I
Um,
think one thing about seeds, people will have to understand is whilst we are talking, maybe my what I've said might have sort of caused some degree of panic amongst new mothers, but that's not the intention here at all. You have to imagine there are millions and millions and millions of babies being produced every year and every day in the whole world. Out of that, the number of people getting these problems are fairly low in terms of the, and you probably get more chances of deaths from other conditions than this. So it is just the awareness which is important, and that's the reason why I just mentioned about sleeping together. We have a tendency of sometimes putting the baby on their face, so basically
Yeah.
prone, and because that helps them burp better. That's helped them not have that much of reflux, and that's a known position. But as long as you're awake and looking after the baby whilst you're doing that, you're okay. But if you're going to be asleep very soon, you should always put the baby on your back, on the back, so that there is no chance of getting prone and getting smothered.
So I think also the advice has changed. I think initially people would put their babies on their stomach to sleep, thinking that it would help them sleep better. But I
Yeah,
think now the general consensus is that you definitely make them sleep on their backs.
yeah.
So yeah. The next question that I have, and it's come in our comment section from someone. My baby is 2.5 months old. She's not waking up at night for milk. What do I do? And I think what she also wants to specify is the child is awake throughout the day, does not sleep, and at night she's asleep. And I think she's very lucky that she's sleeping throughout the night already. But she's not waking up for milk. And the lady who's breastfeeding is either dream feeding her or has to constantly feed her every 4 hours, because that was the advice that she's gotten so far. I personally think she's very lucky, but what would you think?
I would completely agree with you. She's a very lucky parent. That's a dream. That's a dream thing for a parent in terms of the babies doing that. And I would respectfully disagree on what the midwife has suggested here. I think the important thing to note is whether this baby is gaining weight or not. If the baby is gaining weight and is generally otherwise active, then obviously the baby is getting whatever it needs or he or she needs with the amount of milk that the baby is getting during the daytime. So your nutritional demand is met. You don't need to wake up in the middle of the night to feed the baby for that reason. So that's the most important thing. I mean, even with if someone is gaining weight, perfectly fine. I wouldn't bother about waking the baby up in the middle of the night to feed the baby. Doesn't matter, because by 2 months of age they would start sort of going into the mode of not wanting to have 4 hourly feeds. They would want to have demand feeds. They would be taking whatever they need during the daytime, and they would want to have an uninterrupted sleep, which is an absolute dream situation for any parent. I wish my babies were like that.
I know. I can completely relate to that. I still remember the first time my child slept through the night, and she was 6 months old, and I was so grateful. I had forgotten what uninterrupted sleep was like till then. Moving on to uh, greener pastures, literally. So I've got another question which asks, when a baby is discharged, like when it's a newborn baby being discharged from the hospital, there are certain tests that are done to it. So what are these tests? Because I think sometimes mothers or young families are very disoriented at that time also, and one thing after the other is happening. So what are the essential tests that are carried out while a baby is being discharged from the hospital?
Uh, in terms of, I mean, what does the person mean by test? Do they mean by the examination that's carried out for the baby, or do they mean by the Guthrie test that is done at 5 days of age? Has it been
No,
specific?
so yeah. So the examinations, as in, I remember there's a year test to see
The
that
hearing
whether,
test, yeah.
yeah, so the things that are happening in the hospital for itself.
Okay, I mean, because obviously it's not very clear as to which one they are specifying. What I'll
Yeah,
do is I'll just break it down into sort of two
yeah,
phases. One is called an IP, which is a newborn in pediatric examination that we do for newborn babies, and which sort of looks at the general how the baby looks. Is there any dysmorphism in the face? Does the baby look to have any syndromes, for example? Does the baby's head look small, or does the baby's head look big, or is the soft spot open or not? Uh, are there any major things to look for in the chest? For example, is the child opening bowel in the first 24 hours? Have they opened bowels or not? Usually, if they're discharged within the first 24 hours, you wouldn't know that. Midwives then check it when they do the home visit at that, whether they have passed urine or not. So these are things that needs to be made sure, because sometimes babies are born with no opening, no anal opening. So that's the reason why it needs to be checked as well. And sometimes there are conditions which can cause surgical emergencies in babies, and that's why you need to know that bowels are opened as well. You need to from the check point of view, you're looking at the eyes, looking to see if
Yeah.
there's an congenital cataract, which is a condition which happens in babies, and you need to be aware of that. You obviously need to be treated as soon as, if the baby does have that. Then you have got you check your hips to make sure there's no developmental we call it developmental dysplasia of hip, essentially meaning it's not dislocated, the hips are not dislocated or not dislocatable. So the femur bone sits on the pelvic bone in a kind of socket, which in babies are not very deep yet. So they can sometimes dislocate easily, and if they were in breech position, that chances are much higher. So that's the reason why breech babies often need an ultrasound in 6 weeks' time to
Yeah.
make sure that there is no developmental dysplasia of the hip. So that's another thing that is checked. We check for the bowel sounds, we check for the heart sounds to make sure that there is no heart murmur as well, which might suggest, I mean, sometimes babies are born and they might have a murmur in the first week or 2 weeks of life, which is quite normal. And that's called an innocent murmur, because the hemodynamics of the baby's circulation changes significantly from when they were in the womb to when they are adapting to the newborn life. So because of that changes, there are turbulence in the blood flow. That turbulence in the blood flow leads to what we call the murmur, which is called an innocent murmur. But there are conditions which can continue to have a murmur because of the fact that there is connections between the different chambers of the heart which hasn't closed. So those are the ones that needs to be checked. That's why the GPs do a check at 6 weeks as well. If there is a persistent murmur to be heard in the first week of life, then that gets checked again at 6 weeks of life
Mm.
to see if the murmur is existent or not. And if it is existent, then there needs to be referred for a recheck again. Then in the checks, we look at the fit, the joints generally as well, to make sure the joints are all looking okay. Making sure that the child's the genitalia looks fine as well, that there is no I mean, we used to previously it used to be called, our common parlance, it still used to be called ambiguous genitalia, but it's mainly now it's disorders of sex orientation is what we call it now. And it's essentially to make sure that the child is either a male child or a female child, and it's not someone who doesn't have a definite sex denomination. So essentially that needs to be checked as well, because they need to check the internal organs, need ultrasound for that. So these are rare ones, these are rare aspects, but overall examination is mainly to look for any abnormalities which is very obvious, any abnormalities in the heart, any abnormalities in the belly, any abnormalities in the joints and the hips. That's the overall examination. So that's the examination bit of it. Then comes the tests, the Guthrie test, which is done on the day 5 of life.
Right. Mhm.
Tests for I mean, it is an ever increasing list of tests that have been introduced in UK, and it's sometimes very difficult to keep up with all the things that has been done. But in this country, the few ones that are done are obviously thyroid ones. You check for thyroid, you check for cystic fibrosis. So those ones are done as a screening test. You check for sickle cell disease, especially Afro-Caribbean population will be
Yeah.
important, but it's
Mm.
done for everyone. Metabolic disease, so metabolic panels, there are certain metabolic conditions which are done as a routine thing in the Guthrie test. Certain specific metabolic conditions are checked for at birth as well. And thalassemia is another one that's included here as well. And thyroid, so hypothyroidism. So those are the things that is checked in Guthrie. But often, depending on the risk factor for the baby, if a Guthrie is taken, sometimes you can ask for some added tests to be done as well. Or if anything comes back abnormal, then further tests are required for any of them. And that report comes to the parents within a month or 6 weeks. Usually, they get to have the report as well. So that's a test bit. And hearing test is another one that is done as a routine, just to make sure that the child is not born with deafness. Congenital deafness is a condition is usually due to nerve conditions, usually due to the brain evoked activities. So they do the brain evoked activity response there, ABE test.
Yeah. Thank you for that. The next question is, of course, my favorite question here. That is, of course, about antibiotics. And because I think we as Indians, or our community, Southeast Asia, we are quite antibiotic friendly as a population. I think that's the most politically correct way of putting that. And the question here is that if my child is frequently ill with cough and cold, when is it okay to ask for an antibiotic from the doctor?
It's okay all the time, but you might not get it. That's the problem. There's no harm in asking.
Yeah.
Um, Question of antibiotics in babies, there are a few things that needs to be considered. And obviously, as you rightly mentioned, our community, our culture, we come from a medical cultural background where antibiotics are thrown like smarties, essentially, for no reason whatsoever. And as I said, 90% of infections, 90% of tonsillitis, 90% of ear infections, majority of the infections that babies have in the first 5 years of life are viral. So viruses obviously doesn't have any effect on antibiotics. You will have your 4 days or 5 days of fever. It will settle down. It will need paracetamol or sometimes Nurofen to get the fever down. This will automatically settle down by itself. So sometimes when you have a virus, on top of the virus, because the body is weak, sometimes you might get a secondary bacterial infection. And that's when you're considering giving an antibiotic. So if a child comes to us, for example, 3 days or 4 days of fever in the hospital, and they have been having high temperature, not settling down, they're not they're not looking great. They're a bit lethargic. They're not really sort of getting their food and drinks. They are going off food and drinks. All of these could be still viruses. Still, the virus can be causing the problem. But there is a chance that the weak body is now harboring a secondary bacteria because opportunistic infections can happen. And that's when we would consider, if you find a definite focus, for example, if you find lots of crackles in the chest, and when we do a chest x-ray, we find that there's a definite focus of infection in one part of the chest, then that's an indication to give an antibiotics, because there is a possibility that it could be bacterial infection. They will give antibiotics for that. We will check the urine for the baby or child who comes in with 4 days of temperature. And if the urine suggests a water infection, then that will need antibiotics, because that's usually that is not a viral. You don't get a viral water infection. You get a bacterial water infection. So you need antibiotics for that one. So these are the conditions where antibiotics will be thought about if the child is unwell. The general rule of thumb, and that is, again, in medicine, nothing is black and white. Everything is a bit on the gray side. And the general rule of thumb that I tell parents when they ask me about this question, and I get these questions quite often, is, if your child is having very high temperature, and you will find that with viruses the temperature goes to around 40-41 degrees,
Yeah.
whereas with bacteria it hovers around 38-39 degrees mostly, simply because bacteria tend to dampen the immune system quite significantly enough not to mount that kind of response, which viruses still allows to mount as well. If a child during the height of temperature becomes very unwell, become very lethargic, which is quite normal because you're having a high temperature, and as the temperature settles down with the paracetamol, then the child is then jumping around and active and running around, and then the temperature starts coming down again, and the child is again dampened and again lethargic, then that's very much in favor of a viral infection, because you are kind of waxing and waning in during the temperature, but in between temperature you're very well. In
Mm.
bacterial infection, however, you will find the child is mostly lethargic throughout, even when the temperature is not there. They're still preferring to sort of just lie down in the bed, not wanting to do anything. Now, that can happen with viruses as well because you're not drinking and you're not eating enough during the viral infections. So they become lethargic because of that. So it is no definite way of knowing that this child has got a bacterial infection or a viral infection. If you're having temperature for 3 to 4 days, then I would suggest, obviously, you need to go to your GP or seek help from the emergency department, get seen. Sometimes, if we find the child is unwell enough, we would do some bloods as well, and we would check for an infection marker called CRP, and the CRP is very high, and we would deem that as a possible bacterial infection, although that can happen with viruses as well. The problem with antibiotics, first of all, is resistance. The more you use, the less they can be effective when you actually need them in the future. Second is, we have got a lovely flora of friendly bacteria in the tummy, which helps us to deal with a lot of problem. It helps us with our digestion, our growth, our nutrition. Everything is related to that friendly group of bacteria which we want them to be in the gut. When we don't have them, when we are having recurrent antibiotic courses, we are killing those friendly bacteria because antibiotics do not differentiate between the bad bacteria and the good bacteria. They will kill the good bacteria as well. You will find that these children then have a lot of recurrent diarrhea problems, a lot of digestion problems, a lot of reflux problems, a lot of vomiting problems. All these things can then sort of happen with them. They're not getting much weight because of the fact that digestion is not happening properly. So those kind of things are the risks of using too much antibiotics in these babies, which is a reason why there's a policy as to when you use antibiotics in this country, which unfortunately, because in India, practice is very different from one person to another, and there is no general consensus in terms of using antibiotics. Any GP, anyone with little knowledge of pediatrics might do so. Because that's if they don't do it, then parents would not go to the doctor again. They will go to the doctor next door, which is what happens. So doctor shopping is very, very common in India, whereas in here you have a system which, if something is done in Orkney Islands, it will be done in Isle of Wight as well, and that's where the standardization comes into play.
Right. So basically, antibiotic is like a hired mercenary. It's killing everyone in its path. It doesn't care whether you're a good guy or a bad guy.
Yeah.
And do you think, for example, someone is getting antibiotic anyway? Um, should they be given some supplementary like lactobacillus or any of like a yogurt or something to build up gut health additionally, or
You have
is that all
opened up a
myth?
big can of worms there.
I do that. That's my nature. I shall not
Okay.
go there.
Now that particular topic could be. I normally do a teaching session on that for an hour for that particular topic. So I'm not going to go in that details. What
We
you what
found
you
an
have just
episode of
mentioned
Healthy
is it's
Bath.
called probiotics.
Probiotics,
We talk
yes.
about probiotics and prebiotics. So
Yes.
these are probiotics, meaning obviously pro life. Biotics is life. So you're helping the gut bacteria. Probiotics are helping the good bacteria of the gut. You mentioned something about yogurt. Remember one thing: bacteria to live must be in a temperature variations of 15 to 30 degrees kind of range. Ideally 17 to 25-degree temperature. If you're using things which are advertised
In the
as giving you
fridge.
lots of stuff which is kept at 4 degrees centigrade, your chances of those bacteria being effective and active enough to help your gut is nearing on the negative side, or maybe zero, I would say, between 0 to 10, but not much effect in terms of giving you actual friendly bacteria push to the gut. If you want to use it, and then again, the jury is out on probiotics, and there are multiple researchers. And interestingly, many of the researchers comes from Italy, where probiotics is very rampant, and many of the
Right.
companies come from those areas as well. So they have suggested it's very good for your gut health, and lots of studies have proven that, but not always supported by other studies in other countries generally. But there is a general consensus that there are few bacteria. Lactobacillus group is definitely one, and in that lactobacillus group, there's Lactobacillus cereus, which is a common one, and you need to have them in excess of 50 billion CFU, colony forming unit. Okay, so if you do not have that kind of degree of bacteria in the product, then you are not really helping in terms of the gut health bit. So you need something which is a medicine. In that case, you need something. There are different brands. There are lots of brands which are there. Biocool. There's not the yogurt one. There's actually a product. There's something called Protectis as well. Probiotics. You can buy that over the counter. In there's a website, www.biogaia.com. So these are ones, and I would recommend, if you're buying those probiotics, you're better off um, doing that from their own website rather than buying through Amazon or eBay, because all the false products can be there. So that's something that can be given. And it is, yes, there are different studies that have shown severe IBS kind of symptoms, babies who are crying all the time, lots of different colics. I think you had some questions about colics before, previously you asked me
When
as
we were
well.
talking, yeah, yeah. Mhm.
Yeah, and that are things which have shown some benefit with probiotics, and you can use that. If a baby is needing antibiotics quite a lot, then yes, definitely makes sense to give them some probiotics, because you're then helping boost up the numbers of the friendly bacteria in the gut by doing that. That's in summary of
I think we just have another episode for this. Now this, well,
excuse
it's
me.
very similar, but I think this is something that you and I were discussing offline, was on CMPA, and that's the cow's milk protein allergy. What a lot of people generally put under an umbrella bracket, including me, and we call it colic. And what is it?
That's 10 kind of worms.
Yeah.
So yeah, I used to do the GP talks. I do the local GP teaching on CMPA quite a lot as well. So that's a big topic. I mean, you have mentioned two big topics in one breath: colic and CMPA. So cow's milk protein allergy is because we are having more and more awareness of the condition, and we are getting more and more used to it. People don't realize that you can have CMPA or cow's milk protein allergy in breastfed infants as well, because mom's having dairy, and that can go through the breast milk, and that can give symptoms as well. Colic generally is a condition which is common in babies, and there's a 333 rule. I'm not sure whether you have heard of the 333 rule or not. If you're having
No.
more than 3 hours a day of crying, more than three times a week, and more than 3 weeks, then you are deemed to have sort of colic, infantile colic, generally. Now, one thing I have to remember: infantile colic could be just an idiopathic thing, just something that baby is having because of the fact that baby's food hasn't been digested properly, and they're getting a lot of gaseous distension of the intestines. Because of the stretch of the intestines, they get the cramps and they get colic. They cry till they get rid of the gas, either through birth or from the back end, and that helps them settle down a little bit more as well. Some children will carry on inconsolable crying as well, and that they're not, whatever you do, whether you give them relaxation, whether you put them upright, whether you do a bit of a massage, they carry on inconsolable crying. You then start seeing that they sometimes have a rash as well. They sometimes don't gain weight. So then you're thinking in terms of cow's milk allergy. If you have bleeding from the bottom in a healthy looking child as well, if you're having bleeding from the bottom, then you have to think of cow's milk allergy as a first cause here. And colic, so CMPA, symptoms of CMPA could be colic. Symptoms of CMPA could be reflux. So sicky baby, lots of sickness coming through as well. So 40 to 50, 45% of gastroesophageal reflux happens due to cow's milk protein allergy. The rest are mechanical ones. We all have reflux. Every human being has reflux at least 3 times an hour. We will have food coming back, but it then goes down again and doesn't give us symptoms. We sometimes kind of do a bit of
Yeah.
a hiccup or
Burp.
a
Yeah.
burp, and that way sort of we know it's come up and some of the gas is released. Or sometimes we don't get that to that degree. It just comes up a little bit and goes down back again. In babies, obviously this is much more pronounced, because babies generally for the first 7 months of their life are flat, horizontal. So the effect of gravity is not there for them. So effect of gravity helps when you're putting them upright or when you're putting them in a car seat. That helps them comfort a little bit. Helps them also on the pressing on the tummy in terms of getting rid of the gas, which they can't do them by themselves. So these are things that you can do for colic. But if you're having a baby who is continuously crying and significantly crying a longer duration of time, then you need to seek help. You need to sort of ask for advice.
Yeah, I think For the first couple of months in a baby's life, and especially if it's a first time parent, colic or the stomach pains, this just becomes a very difficult situation to deal with it because you don't know why your baby is crying. You fed them, you've cleaned
Excuse me.
them, you just don't know what is happening. And I think it's an important distinction to make between colic and CMPA because they would have two different ways of addressing it. Um, Coming to digestion issues also, for very young babies, I know you can't give them a gripe water, but there are something like I don't know if it's a brand name, but we used to give them something called Infocol.
Infocol.
Um,
So Infocol is
Infocol,
simethicone. So Infocol is a medicine. It's an allopathic medicine.
yeah,
It's simethicone. It is a anti-flatulent uh, medicine. So you're basically trying to reduce
right.
the blood and the gas. I mean, if it is genuine colic and if it's genuinely because of the gas buildup, then Infocol will help. If it is a colic, if it's a colic, when we talk about colic, we are talking about it's like what we are discussing here is like fever and pneumonia. Okay,
Yeah, okay.
fever is your manifestation of a symptom which could be due to water infection, could be due to chest infection, could be due to tonsillitis. Everything could have fever. Whereas pneumonia is specific in terms of a condition. So CMP is a condition. Colic could be part of CMP. Colic is your manifestation. So colic could be just normal for babies, could be a manifestation of different other things, could be a manifestation of different surgical emergencies sometimes as well, if it is a prolonged inconsolable cry. So those are the kind of things you need to differentiate. A little bit of cry for some time, then settling down as you relax them, as you sort of put them up. That's colic. That's fine. Most of them will go away by the time they are 3 4 months of age, and they will settle down. If they continue beyond that period and having and or before that even inconsolable crying, that advice needs to be sought for that. That's definitely there because you then need to consider a prescription milk. You need to consider a change of milk, which is a broken down formula. Hydrolyzed formula, we call them hydrolyzed formula, or further broken down called amino acid based formula. So these are hypoallergenic formulas. Oh,
So
one
I
other thing
have,
about
yeah.
colic differentiation. If a parent is seeing a child is really screaming whilst they're trying to pass a poo and looking like they're constipated, can't pass a poo and struggle for a day or two and goes red in the face and then produces a completely liquid, explosive stool, you need to be aware that there's a possibility of cow's milk protein allergy. This condition is called infantile dysphagia or painful defecation, painful pooing. Happens because of the allergic reactions causing an inflammation in the bottom passage. That's the reason why they scream while trying to pass a poo, but actually it's not because of constipation, it's because of a
No,
explosive
allergy.
stool, but
Oh,
it's the effort of trying to pass the gas or pass the poo which makes them cry that much. And that's one of the things that often is associated with cow's milk allergy, just to be aware of.
from, yeah, I think well, I won't say the last question I received while we were having this episode, a lot more questions. So we definitely have to come back to that sometime later. We don't have the time. But the one question that I have is on allergies. And um, I think a lot of the times we don't understand, we don't recognize what is an allergy. With maybe you have spots in your hand or like a rash or something. Would an over the counter medicine work? Or at what time do you need to refer to the GP or to the emergency services? What is that demarcation of me, say, giving the child over the counter medicine and me calling up the emergency services or taking him or her to the GP.
Again, an extremely broad topic because it has got different balances in terms of how you deal with it. But just as a kind of brief summary of allergy reaction, from the allergy point of view, what you're looking for is obviously a florid rash that comes up, raised red rash, not a flat one, just red rash. Sometimes can become very itchy. Sometimes they can have difficulty with breathing. I mean, in babies, they won't have the obvious signs. They might just vomit big time. They might sort of have issues with not being able to breathe properly. So those things will need to be aware of. That's severe reaction, and that has got no place in waiting at all. You call an ambulance and go to emergency services straight away. So that's Flurry dress that has suddenly come up with something that they have taken new product, like when they're weaning into sort of say eggs or used fish or something like that, and then they have come up with something severe which they haven't had before. You need to consider that this is a severe allergic reaction. You need to go to emergency services straight away. So that's no debate about that. You just straight away go seek help, because they need medicine straight away. In terms of, sometimes they need adrenaline as well. They need sometimes, from a breathing support point of view, they sometimes need fluids as well. Second one is, you're eating something and you just come up with some oral rash just around the lips, maybe a bit dribbling up here, and sometimes you will find babies getting in the bib area. They will get some redness and coming up there with some raised papular spots, or papular meaning raised spots, red spots. That's more of what we call oral allergy syndrome, which is localized, which is mainly contact dermatitis. So these are in contact with the skin, with that particular food, you're getting the local reaction. These have got very little chance of um, going into a florid anaphylactic type reaction. It is something that is localized, and you can use anything like like Piriton, which is your over the counter medicine. You can use it from 1 month onwards, not a problem at all. You can give 1 mil, which is 2.5, 1 milligram, which is 2.5 mil of Piriton, and as after a certain age it increases to 5 milligram, which is 5 ml, which is 2 milligram dosage. That's after 2 years of age. So Peyton can be used, and Peyton I would recommend keeping in the house for little babies, because you never know when they can come out with a florid rash. If you're not sure, you can always give some Peyton before you seek help, because it will help in terms of dealing with the anti-allergic process that way. But if you have any doubt that this could be an allergic reaction, if you're not sure, I would definitely seek help. This is one condition that can prove quite dangerous if it is not treated straight away.
Yeah, that always gives me, I get hives when I think of reacting to allergies, because that's you have to be really quick um, diagnosing that yourself, understanding what is the level of care required, act very quickly on it as well. So it's not something you should wait and see whether it will clear up by itself.
Allergy is something. I mean, obviously, all my patients that I say that seek help ASAP if you're not sure. I mean, you might then turn up in the ED and they say, "Oh, there's nothing at all. This is just a viral rash." That's fine, but you're better off doing that than not doing anything.
Dr. Chakrabarty, I think people generally say that parents don't have a handbook, especially new parents don't have a handbook. But it is thanks to medical professionals such as yourself that I think the journey of parenthood is cushioned to much, a huge extent. I'm eternally grateful for you addressing these queries that we've had. I know we've not covered all of it. I have opened a lot of tin cans here, and more tin cans are in the comment section. More tin cans have been coming to me as messages. So we would need to probably address that later. I am conscious of the time. Thank you so much, Dr. Chakraborty. It was great to have you with us. As again, disclaimer that all medical opinions stated here are of the expert. And if you have any other questions regarding what we have discussed, please feel free to comment, and we'll see how we can get back to you on that. With that, I would like to
Thanks a lot, Meghna. Thank you
invite.
for everyone joining in this chat. And as if you have any questions, if you want to forward that to me, I will try and answer them so you can reply back to the concerned parents. One thing I would like to tell everyone here: our best teachers are parents. So don't
Yeah.
ever feel fearful about not knowing in new parenthood as well. We learn more from parents than we do from medical books. That's one thing. Parents and patients. And secondly, I always feel, as a pediatrician, after having done 25 years of pediatrics now, I always feel the person who knows the child best is the parent, especially moms. I mean, I don't want to be gender biased here, but it is a truth that maternal instinct definitely exists. And maternal instinct is something that cannot be replaced. So I would definitely say, if you are worried about something, then seek help.
Thank you very much. With this, we will end our session. Hope to see you all again for episode 3. We'll keep you all posted. Thank you. Good night.
Thank you. Good night.